let's talk about the weight loss drugs, because it seems like one of the first things that Trump did in the Maha lane was to take them off of the Medicare and Medicaid too options. But that seems counterintuitive because being fat causes everything.
It's true. It's complicated. I mean, Medicare Part D is the drug benefit for Medicare. It's $145 billion. If you treated all the obese people in Medicare with Ozempic, it would be, I think, $267 billion just for that.
But wouldn't it then lower the cost of the other things they need?
It might. But the question is there a different way to go about this? And can you get the same benefits? And what is going on with our food system and the causes of this? So it's easy to look for that quick fix or the quick jab that's going to solve all your problems, but it doesn't come without risk. So when you take these drugs, one, you might feel nauseous and not feeling great. So that's probably how it works. It makes you not want to eat because you don't feel good.
Yeah.
So who wants to rock around with that? And most people discontinue it after the first year. I mean, it's a big discontinuation rate because of the side effects. Not only that, those are short-term, kind of short-lived side effects, but we see a 400% increase in bowel obstruction, which needs surgery. We see a 900% increase in pancreatic injury. We see increases in thyroid cancer, although people debate that, whether it's just in animals or not, but it's still a concern. And you see people losing half their weight as muscle. Muscle is where your metabolism is. So here's the problem. You lose, let's say, 50 pounds. Half of that's muscle. You get off the drug because most people stop it. You gain back the weight. Then what?
Now it's all fat.
All fat. So then you could be the same weight you were when you started.
Except a lot
flabbier.
Oh.
Metabolism will be slower because muscle burns 7 times the calories as fat. So you need to eat less at the same weight just to maintain that weight. So it's a slippery slope unless you are. And I think this is something that we've talked about in some of the policy conversations we have had. If you're going to give this drug, it must be delivered along with a nutrition counseling program that makes you eat at least a gram of protein per ideal body weight. So let's say per pound of ideal body weight. So let's say you're 120 pounds, you need 120 grams of protein. And a strength training program. So you keep your muscle. And if you don't do that, there's a huge risk on the backside of it.
You're going to be skinny fat.
Skinny fat. Yeah, it's right.
Yeah, I know. It's a terrible situation. Nobody wants to be skinny fat. It's like you look good in clothes, but then when you take the clothes off, it goes downhill fast.
There's another word for it called tofu, not tofu. Thin on the outside, fat on the inside.
Oh, yeah. Nobody wants that. That's fine until you get to beach season, and then it's...
These are an important advance in medicine, but they have to be prescribed intelligently. They have to be done in the right way for the right person. It's not a panacea for everything, and we have to fix our food system. And we have to fix the reason why we're fat.
But if you had a morbidly obese person come in to see you, you wouldn't consider saying, you want to check out Ozempic?
I think, what did we do before this? There's a woman working with me who's been working with me on my nonprofit for years. She's now the first lady of West Virginia. She lost over 100 pounds just following some simple guidance that I gave her about what to do. She's a brilliant woman, but she didn't ever know about nutrition. And I saw another woman in Cleveland Clinic who had heart failure, type 2 diabetes, hypertension. She had multiple stents put in. She had fatty livers. Her kidneys were starting to fail. I mean, she was on her way to a kidney and a heart transplant. And within 3 days, and this sounds crazy, but she was off her insulin by changing her diet. In 3 months, she reversed her diabetes. Her A1C, which is your average blood sugar, went from 11 to 5.5, which is normal. Her heart failure reversed. We call it the ejection fraction, was how much blood you can pump out per minute. Again, that got back to normal from being low. Her kidneys got better. Her fatty liver went away. She got off her medications. She saved $20,000 in copay. I don't know what Medicare was covering for her, but that was her copay. You save a lot of money, and it's just about teaching people the basics of what to do. And most people don't know. Like that family I was talking about. This was the pre-Ozempic era.
But a lot of people know, and
some people do.
Very hard.
But some people do, and some people just don't know. And I think that's what I have changed over the years. I sort of believe, like I said earlier, that people who are overweight or who have these conditions, they know better, but they just don't do it.
No, it's more than that.
They don't know because the whole society has sort of made it hard for them to know.
I got to ask you, this is a different category, but I got to get this in. EMF and RF. Yeah. This is like...
Should we be worried about it like Wi-Fi and Bluetooth?
And so-called dirty electricity coming out of your outlets.
Yeah. How big of an issue is it? I don't know. I don't think that there's a lot of good data. I think there's some data that there may be some issues in human biology. When you think about it, we're electromagnetic beings. You have your heartbeat, your brain waves. We can see those electrical signals. You know that if you go into certain areas, there's interference with your phone. So the stuff actually we know impacts our electromagnetic system. How it's linked to disease, how bad it is, I think it's very hard to understand or study because you can't do a randomized controlled trial with this. Yeah. You can't take...
Wouldn't we all be coming down with cancer if exposure to Wi-Fi caused it?
Yeah. I mean, I mean,
everybody.
The thing is, we are seeing increasing cancer rates. So people say, heart disease deaths have gone down. Yes, because we have better treatments. But has the incidence gone down? No. We've seen more people with heart disease, more people with cancer, more people with every single chronic disease, Alzheimer's, diabetes, you name it, autoimmune disease, it's getting worse across the board. And so it's multifactorial. It's not just one thing. And could it be a factor? Yeah. But I think.
Do you think twice about having Wi-Fi in your house?
No, I do, but I turn it off in my bedroom, and I notice this. I mean, this is totally anecdotal, but when I go camping or I'm sleeping outside, I sleep better. My whole well-being changes, and it could be nature, it could be a lot of other things, but I always wonder if that, or sometimes even when the power goes out, because when the power goes out, sometimes it goes out for 3 or 4 days. Wow, I feel a lot better. I sleep better. I mean, it's kind of amazing. So that's anecdotal.
Tariff wars, stubborn inflation. No wonder gold has been routinely hitting all-time highs. In volatile markets like the one we have now, don't sit on the sidelines with your head in the sand. You can take control and safeguard your savings. Aren't you thinking about that today? That's why so many Americans today are turning to Birch Gold Group. They've helped tens of thousands convert an existing IRA or 401k into one in physical gold. Is it time for you to hedge against economic instability or market instability with gold? To learn how to own physical gold in a tax-sheltered account, text MK to the number 989898. Birch Gold will send you a free, no-obligation info kit. Again, just text MK to the number 989898. With an A-plus rating with the Better Business Bureau and countless 5-star reviews, Birch Gold has helped many protect their savings with gold. It took us decades to get into the tangled mess we're trying to unpack right now. How long will it take to get out of it? And at what cost? Text MK to 989898 today. Thanks so much for watching. If you like what you just saw, hit the subscribe button for more clips and full episodes.